Stedman is a virologist and professor of biology at Portland State University. He joins us now from Portland. Hi there. Thanks for joining us as always. Ken, we're seeing a decline in cases. We've also seen where we are seeing a decline in cases, we're also seeing highly effective tactics that all other affected countries can't seem to employ. Why, for example, is the U.S. not doing what South Korea has done?
Andrew, that's a great question, and I think the answer is we don't know, but it's great. You've been emphasizing testing, and testing is absolutely critical. And as you said, South Korea, that really seems to be the way that they've gotten ahead of this disease. So the hope is that we're going to be able to get more testing online more rapidly here in the United States. In fact, yesterday I was talking to one of my colleagues at the local medical center, so I could actually help out in trying to do some of that testing.
Okay, it's just such a tragedy that wasn't enacted sooner. That countries like South Korea and China were able to get that testing on the ground and force it immediately. A lot of time has now been lost in countries like the United States. But still, let's look again at East Asia. There is actually a concern now that even though the virus seems to be all but disappeared in China and South Korea, it could take only one, careless infected person to start the entire epidemic again. How much of a danger is that in reality?
That's a wonderful question, and I'm not a public health expert or a coronavirologist to be able to give you a really clear answer on that. The hope is that we now have at least some immunity in the population, and so hopefully if you get more cases, they should die out much more quickly. We don't know that yet, and we'll find out, I think, relatively soon as China is now coming back to work and there's much more interactions between people.
That is exactly what I wanted to ask you about, but it seems it's not clear yet because we have been celebrating a number of recoveries. There's, upwards of 88,000 recoveries. We don't know, though, if those people are actually now immune from recontracting the virus, and if they do recontract the virus, could it be even worse if they get it again and beyond, the immune system's response?
So again, this is not my area of expertise, but what I have heard is that those people who seem to get potentially reinfected, although it may be a previous false negative, they may have been infected the whole time, but even if they do see another case, it seems to be much milder than the first time around. And so in terms of this multiple infection, seems to be really not a major issue. And there certainly are good cases now where people who have recovered are now not only resistant to disease, but also are producing their own antibodies, which people are now trying to use for therapy for people who are just getting infected by the disease. So we know that there is immunity which is happening to this new coronavirus.
Okay, at least that's encouraging. All right, Ken Stedman, we'll leave it there. Thank you so much for that from Portland.